In the name of Allah, rules of therapy from prophetic repetition. Zaytuna Cupping Center, Medina, Saudi Arabia. This meeting with the channel of Rules of Therapy from Prophetic Repetition aims to discuss the definitive management of the challenge of Helicobacter pylori. The world reports confirm that the Helicobacter pylori antibiotic eradication therapies include a lot of controversy. H. pylori, being a natural bacterium, can never be defeated. Antibiotics are successful only in forcing it to migrate from the stomach, where complications start. H. pylori is not eradicated, but forced to migrate as proved by unusual existence in dental plaques, rectum, tonsils and adenoids, and unusual symptoms and sequels caused by this unusual existence. That's further confirmed by the fact that pseudomembranous toxic colitis and toxic megacolon developed after antibiotic eradication of H. pylori from the stomach. Antibiotics are seldom effective against extragastric H. pylori strains. A British study in 1983 demonstrated failure of antibiotics to eradicate any of the H. pylori strains from dental plaques. H. pylori eradication therapies are not effective as proved by the common recurrence, the emergence of resistant H. pylori strains, flare-up of a lot of H. pylori related medical challenges. If H. pylori is kicked out of shelter and its nature is mutated due to the antibiotic aggression, the original nature of the bacterium can never be restored. The migrated H. pylori strains cannot be resettled back to its original natural habitat in the stomach. It's a challenge. The emergence of the immigrant H. pylori strains, once existed in a person, could remain migrated for life with its drastic effects unless eradicated. Antibiotics then are not the solution, as it's the reason of the original aggression, and aggression creates aggression. It's a true fact. Whenever man interferes severely in the nature, dilemmas are brought up. Research-wise, it's not scientifically sound to accuse a natural bacterium of encoding virulence if it's forced to change shelter and became a foreign structure to the tissues. Research-wise, it's not scientifically sound to blame a biological bacterium for using its natural ability of gene diversity if it's created to struggle for survival to fulfill an entitled biological function. Hence, what is the definitive and ideal management of the challenge of H. pylori? The nutritional requirements of H. pylori include particular dislocation sites. These sites should attract any strategy aiming to fight the abnormal H. pylori strains. The sources of energy for H. pylori are via pyruvate, while the activity of the pyruvate dehydrogenase complex is controlled by the rules of feedback regulation and product inhibition. As bioorganic acids, lactic, formic, and acetic, are demonstrated among the end products of pyruvate metabolism, therefore, addition of any of these organic acids to the atmosphere around H. pylori will lead to direct immediate inhibition of the pyruvate dehydrogenase complex with immediate paralysis of H. pylori. Accordingly, intake of vinegar mixed salad among meals is an ideal, safe, effective measure to get rid of the abnormal behavior H. pylori strains that exist inside the gastric lumen during presence of food. Vinegar is a food that includes health, not a medicine which is diluted in water and taken on empty stomach, as vinegar can lead to immediate deaths of bacteria upon brief exposure. Vinegar is a weak acid, but it's not a matter of acidity, it's metabolic. It's metabolic interference with sources of energy for bacteria. So effect of vinegar on bacteria is dramatic and fast like magic. Therefore, vinegar on empty stomach awfully scares bacteria more than antibiotics, pushing it to migrate from place in panic. Hence, vinegar on empty stomach is worse towards natural bacteria than any drastic antibiotic. In addition, vinegar has got a great strong taste and smell that could frighten bacteria from very far. That's why food is an alarm to useful bacteria in the stomach to hide under the safety of the mucus shelter from any harm. While mixing vinegar with salad among the meal masks taste and smell of vinegar, surprising bad bacteria present in the lumen during presence of food and kills it. This explains that the alternative medicine therapists who advise vinegar in water for slimming purposes are not aware of the secrets of therapy with vinegar. It also confirms that the accurate scientific reference in vinegar therapy that vinegar is a food including health, not a medicine to dilute and drink, is an entire solid scientific knowledge which is essentially and absolutely derived from prophetic reputation. Best food is vinegar, best dip food is vinegar. The potent natural senna extract purge is the ideal, safe, effective measure to get rid of abnormal existence H. pylori strains from the colon. The senna performs justified colon clear of its contents. It kills and expels all bacteria in the colon. It absorbs and eliminates all colonic toxins and readily gets rid of the contaminated old mucus layer. Justified colon clear means that once colonic contents are cleared, diarrhea stops automatically, a function which is not available in any medicinal or pharmaceutical preparation. The FDA reports describe the senna extract purge as a safe laxative that does not need a prescription, meaning it's obtained from herbal stores. H. pylori existence is essentially a sanitary conflict before it's a medical challenge. Sanitary problems should be treated by hygienic and antiseptic measures, not antibiotics. Then vinegar is the answer. In condition that H. pylori is a natural existence, natural problems exceeding limits are corrected by natural measures, not antibiotics. The answer then is the senna purge. The link of the published related research articles, a comparative study of natural eradication of Helicobacter pylori versus antibiotics, and the alternative natural remedy for symptomatic relief of Helicobacter pylori dyspepsia, and the definitive eradication of Helicobacter pylori from the colon are attached to the video. Then, for the next meeting with the channel of rules of therapy from prophetic reputation, to summarize and spotlights on a novel topic: biological benefits of Helicobacter pylori and the intelligence of juxtamucosal ammonia of H. pylori. Zaytuna Cupping Therapeutic Centers, Medina, Saudi Arabia.